It's a pleasure to be here today, and the topic that I'm going to go over is something related to peri-implantitis, but I'll be talking about retrograde peri-implantitis. Over this 20 minutes, I'm going to go over a few things related to this topic. Basically, I'm going to start with a brief introduction, a definition of retrograde peri-implantitis, the etiology of it, a classification system for it, the treatment, the prognosis, and a take-home message. Basically, this is something sometimes we see in our clinics, and basically we see some radiolucency around the tip of the implant, either in the mandible or in the maxilla. Sometimes we see it in the maxilla very close also to endodontically treated teeth. To start with, I'm just going to talk a little bit about the research and the evidence, and if you go to PubMed, basically what you're going to see is only case series and case reports when it comes to retrograde peri-implantitis. So we do not have the excellent terms of evidence-based systematic reviews or randomized clinical trials about this topic. There are multiple definitions of RPI. It was defined as a symptomatic periapical lesion after implant placement, whereas the coronal portion is not problematic at all, and the implant remains osseointegrated. It could be defined as a localized osteomyelitis secondary to endodontic pathology. It could be defined as an active implant periapical lesion. And why does it occur? Basically, one of the causes could be bacteria in the extraction socket. Another cause could be related to previously root canal treated teeth.